Hello friends, I am Dr. Manish Garg, a cardiothoracic and vascular surgeon practicing in Mumbai. I have done my MBBS from St. GS Medical College and KEM Hospital, MS from BJMC Pune, and MCH cardiovascular thoracic surgery from Nair Hospital, Mumbai. I have also had a valuable experience as a heart transplant fellow. I have gained valuable international experience by working as a heart transplant fellow in Canada and Australia before returning to India to set up my practice here. What is an oral anticoagulant? It's basically a medicine that helps to prevent formation of blood clots and enables a smoother flow of blood. Warfarin is one of the such oral anticoagulants which is used to treat and prevent formation of blood clots in the body. It helps in dissolving the clots as well as prevents formation of blood clots and enables good blood flow throughout the body. So when do we use these oral anticoagulants after cardiac surgery? The main indications include after a heart valve replacement surgery, mainly a mechanical heart valve or a metallic heart valve, for some duration after a bioprosthetic or a tissue heart valve surgery, for patients having atrial fibrillation undergoing cardiac surgery, oral anticoagulation is warranted. So how do you monitor the effects of oral anticoagulants like warfarin? This is done by a simple test called PT-INR, which checks the ability of blood to clot within the body. Warfarin, being an oral anticoagulant, is very necessary to monitor it because of the effect produced by it within the body. INR stands for International Normalized Ratio. This blood test is simply done by either doing a fingertip prick or collecting a blood sample through the vein. So what should you do if you are taking an oral anticoagulant like warfarin? The most important thing being, you should take the dose exactly as prescribed by your doctor. Your doctor will change the dose of warfarin depending upon your body's response to it. You should take the warfarin at same point of time every single day. You can either take it with food or an empty stomach, it does not matter much. You should get a blood test called PT-INR done regularly as advised by your doctor. It helps to determine how fast your blood clots, and accordingly the dose of warfarin can be adjusted. Do not start, change or stop any medication other than prescribed by the doctor or any other herbal product without the advice of a doctor, because they may interfere with oral anticoagulants like warfarin, and its dose may need to be increased or decreased, or it may have its own side effects. Another important thing is to avoid alcohol consumption if you are taking warfarin. Avoid any activity or sport that may result in traumatic injury. Avoid getting pregnant, or if you are already pregnant, inform your doctor immediately if you are taking warfarin. If you forget your prescribed dose of warfarin on a given day, take it immediately on the same day itself. However, if you forget to take the warfarin for the whole day, do not substitute and take double the dose on the following day. Inform your doctor immediately. The amount of vitamin K in food may affect therapy with warfarin. So it's very important to eat a normal balanced diet with a consistent amount of vitamin K. Avoid any drastic changes in food habits and avoid overeating of green leafy vegetables such as broccoli, spinach, methi, as they contain high amount of vitamin K. Certain vegetable oils also contain high amount of vitamin K and needs to be avoided. Last but not the least, always keep a list of medicines with you at all times to show it to your doctor as and when needed. So when should you call your doctor if you have warfarin therapy? If you get sick, have fever, diarrhea or any sort of infection. If you ingest too much dose of warfarin. Always tell your dentist that you are on a warfarin therapy before she starts a dental procedure. For any elective planned procedures or surgeries, inform your doctor that you are on warfarin therapy, as the dose of warfarin will need to be adjusted depending upon the surgical procedure. If you fall or hit your head, inform your doctor and you need to be checked if you are on regular warfarin therapy. So what should you watch out for if you are on warfarin therapy? The most common side effect of warfarin is bleeding. This may manifest as pain, swelling or discomfort on any body part. Headaches, dizziness, giddiness may also occur due to warfarin bleeding. Unusual bleeding from the cuts or prolonged bleeding during menstrual cycle is again a sign of increased bleeding secondary to warfarin. Unusual bruising, prolonged bleeding, especially from cuts, nosebleeds, bleeding from the gums while brushing, more than heavier menstrual bleeding that is not normal. Dark or brown colored urine, dark or black tarry stools, coughing up of blood, vomiting of blood, or pain in your toes with toes appearing purple or dark in color. Oral anticoagulants like warfarin are life-saving medications used after cardiac surgery and have to be used judiciously under medical supervision to achieve the desired optimum outcome.